Deputy Denis Naughten.
Cancórla, I've been speaking directly with staff outside both Portiuncula and Roscommon hospitals, nursing staff who want to be caring for patients, not picketing. I want to ask a question regarding a commitment in the programme for government, which I believe can provide flexibility that is now needed to overcome the current impasse in the dispute without undermining the national pay agreement. Page 61 of the Programme for Partnership Government states, "We will review the roles and responsibilities of various healthcare professionals working in our hospitals." It goes on to say that this will include further transfer of tasks between doctors and nurses. Can I ask the Minister, can this review now be brought forward in order to avert the 3-day dispute that is planned for next week, which would have a devastating impact on patients awaiting appointments? Thank you.
Michael Collins on the same matter.
Minister, on page 66 of the programme for government, you promised to implement new procedures to ensure more efficient and timely recruitment of nurses. But, Minister, we have a major problem with recruitment, with retention in Nurses Ireland, and I'm not surprised. First-time nurses must be paid the same as other university graduates. The conditions that our nurses work under is unacceptable, with overcrowding and poor support from management. Nurses are rightly angry. Tomorrow, nurses from Scull, Castletownbere, Bandon, Clonakilty, Dunmanway, Kinsale, Skibbereen community hospitals will strike outside the hospitals with their fellow nurses in Bantry General Hospital, fighting for their rights and the rights of the patients inside our hospitals they care for. Minister, there are 5 health ministers, both senior and junior. Can you sit down, do what you will have to do sooner or later, and find an immediate solution to the nurses' pay and conditions before you find these nurses, force these nurses back out and strike again tomorrow?
Deputy Imelda Munster on the same thing.
Minister, the crisis we now have in recruitment and retention of our nurses, and I think you'll have to be forced to admit at this stage that your recruitment drive has been a dismal failure. But Irish nurses working right across the globe are sending messages of solidarity to their striking nurses here, and what they're telling them and encouraging them is to stand up for themselves, to stay strong and to stay out. Now, our nurses working abroad will never come home to work in the profession that they love because of the poor pay and conditions and gross understaffing. Our newly qualified teachers are getting on the first plane out of this place, and the problem of staffing cannot be addressed until the issues of poor pay and conditions are addressed. That's why your recruitment drive has fallen flat on its face. That's why your recruitment drive has fallen on deaf ears. Nurses are striking for that very reason. Good reason, and the public are behind them. So when are you going to get your head out of the sand and deal with the reality that until you address the issue of poor pay and conditions, your recruitment and retention crisis is set to continue indefinitely?
Minister.
Over 3,000 more nurses into our public and health service over the last number of years. We have a national wage agreement that prioritises those on low and middle income for wage restoration and then for wage growth. We have a national wage agreement which, on the new entrant issue alone, has the provision in place to put in place needed and recognised wage increases of €3,000 to deal with an issue that has been raised in this House. I hear Dáil, TD after TD stand up and say we need to pay the nurses more and we don't want to undermine a collective wage agreement. These are the same TDs when we were dealing with the issue of An Garda Síochána in 2016, then accused this government of undermining the national wage agreement. Deputy Naughten put forward a very constructive discussion, a suggestion there regarding how this issue could be moved forward. In terms of the engagement that has happened to date, this issue was attempted to be dealt with inside the national wage agreement that we have now. We then have over a year of engagement on it through the Public Service Pay Commission that produced a report that was welcomed by many TDs who are now criticising us. And I and the government are absolutely open and are trying to use proposals such as identified by Deputy Naughten to try and find a way through this greatly difficult issue. And of course, for every opposition TD today who's raising the plight and work of our nurses, which this side of the House fully recognises as well, of course, they are the same opposition TDs who will then the next day be raising every other part of our public service and asking why they're not getting the same wage increases.
Brady.